My diagnosis was in 1999. And it was a long time coming because the type of cancer that I had is kind of a stealth cancer. It's not obvious, it doesn't make lumps. I had lobular carcinoma. During that time frame, I had recently adopted a baby, so I'd been having it kicking me on the changing table, and a bruise developed, but it didn't go away, and that's what actually drove me to the doctor. I'd been having regular mammograms since I was 30 years old. I was now 47. And nothing had shown up that was of significance. Now it was very significant. Through my mind went, well, look, I've got an 18-month-old child and I've got a 4-year-old child, and I'm not dying now. That's it. So God, I need you to help me. I am not dying now, and I'm going to find the best care I can find. So I started looking through the top doctors. I looked through everything, and I was looking for an approach that I was comfortable with. And at that time, I think Fox Chase may have been the only hospital that had a kind of team approach, or at least in this area. So I looked for my top docs. I found Dr. Mary Daly. I found Dr. Ellen Sigurdson. I wanted to know that people actually were paying attention to me, and if somebody was in surgery, if somebody was not available, somebody else who knew who I was and what I was about was going to be available to talk to me. I went through everything. I was really comfortable because they asked a lot of questions that nobody else had asked, and they were really thinking hard about what was the best approach to take for me. They're all cancer all the time. They're not doing anything else but looking for cures, looking for the best treatments, and they know everything there is to know as far as I'm concerned. I mean, if I'm in the treatment room, if I'm having chemo and I'm suddenly allergic to something, which happened to me, I was allergic to my Taxol treatment, they knew what to do. All I said was, help, something's wrong over here, and immediately it was taken care of. I think it's important to be positive. I expect that the people here know what they're doing. I expected them to do well by me, and as good as it could be, they were going to do it for me. So that's just where I went. That's where I stayed. It's a balance to find the time to rest and heal, and a time to do the things that make you feel alive. And doing the things that made me feel alive were important to me. They'll help you live. They'll really help you live. They'll encourage you to do things. They will not treat you like you're sick unless you actually really are. They'll smile, they'll laugh with you. People here just always encourage you with everything. They ask you, how is your family? How is everything? How are you feeling? What's good happening? What are you doing? And I love that because I didn't want to focus on the treatment. I wanted to focus on the rest of my life. I knew I had to have the treatment. I wanted the treatment. I assumed it would make me well. But the rest of my life was what was the important part of my life, and I went and did it.